My topic is MRI safety, reducing risks and maximizing diagnosis. This is my course outline. So in this presentation, I'm going to talk about importance of MRI safety, MRI terms, risks and hazards of MRI, fringe field, safety screening and patient preparation, advances in MRI safety, practical ways of managing MRI emergencies. Introduction. Magnetic resonance imaging is a diagnostic equipment that produces cross-sectional image, detailed cross-sectional image of the body without the use of ionizing radiation. So it's basically similar to CT. One of the differences is that while CT produces cross-sectional images with the use of ionizing radiation, the MRI produces cross-sectional images with magnetic field. It also uses radiofrequency energy and gradient fields. And because of this high magnetic field and the radiofrequency energy and then the gradient coils, they have their own unique safety challenges and improper handling of these equipment or lack of awareness can result in serious hazard in the radiology departments. Hazard that affect hazard that affect both the machine, the patient, and the staff. So this presentation is trying to focus on this hazard and the ways we can prevent them in order to maximize diagnosis. Importance of MRI safety. MRI safety is important in medical imaging in order to protect patients, relatives, healthcare workers, and medical equipment from potential hazards from the MRI environment. So the the whole reason why we are doing this is just to protect the patient, protect the machine. Of course, we know the machine is not cheap from hazards that may arise from the MRI environment. So there are protocols, their trainings, and their continuous monitoring that we need to know that will help us maximize the benefits. So, definition of some MRI terms. So, we have ferromagnetic, which is MRI unsafe. These items are considered unsafe in the MRI environment under any condition. They must remain outside the MRI scan room. These are items that are known to pose hazard in all MRI environments, such as pair of scissors, knife, gun, nickel, or cobalt, such as okay. And then we have this sign. You see it on most um, equipment or most things that are not MRI safe. You see, you have this caution sign that tells you or forewarns you. Then we have non-ferromagnetic, which are MRI safe. They are objects with this type of label that is seen here, that is being displayed. They are non-metallic, non-conductive, and non-ferromagnetic. They have no restrictions as to their use in MRI environment. These include plastic, aluminium, bronze. They also include non-conducting, non-metallic, and non-magnetic items. These items can be used in the MRI room. We can take it into the MRI room without any form of risk or harm or fear of any form of danger that may occur. Then we have the MRI conditioner. These they can be used in specific conditions. Yeah, you cannot. There are some magnetic field that you can use them. There are others that you cannot use them. They have specific conditions. We may talk about maybe due to the field strength of the magnet or due to the RF field. So for MRI conditioner, you have to actually find out about this whatever equipment it is. Find out if it's conditional and related to your machine specifications if it can be allowed in. So only items that are marked MRI safe are permitted in the magnetic field. If there's any safety, if there's any question that concerns the safety of any item, do not allow it into the magnetic field until you have fully verified that this machine is safe, considering all specifications of your machine. Now, risks and hazards of MRI. We have magnetic field related risks. These are risks that are available or risks that arise due to the magnetic field. So number one, we have projectile effects such as missile effect. It's called also called missile effect. So several magnetic materials such as keys, scissors, wheelchairs, oxygen tanks can be pulled into the scanner at high speed, thereby causing serious risks of injury or death. Like in this image we have here, we can see that a wheelchair was pulled into the MRI machine. So this is what we call projectile effect. Then we also have risks on medical implants and devices. We said medical devices such as pacemakers, aneurysm cleans, defibrillators, cochlear implants, they may be affected by the magnetic field, leading to malfunction, movements, or heating. So when these medical devices, when they're in presence of a magnetic field, they may move and most likely cause harm to the patient. They may be damaged. They might even cause the death of the patient. They might even cause heating in the patient body. Then we also have biostatic effect of static magnetic field. So we have dizziness, we have vertigo, nausea, and a metallic taste in the mouth. It can occur when when moving through a magnetic field. So we said that metallic taste is experienced in about 5% of patients who undergo routine MRI at 7 Tesla. So this biostatic effect of static magnetic field, it is most times related to the type of machine. So say for 5% of patients who have gone through an MRI procedure with the 7 Tesla machine, they have experienced this metallic taste, but only rarely among machines that are 3 Tesla and below. We also have magnetophosphenes, which is seeing flicker or flashes of light, and said that is experienced due to the magnetic field interaction with the retina. So instead, that studies have shown that it occurs in only 1% of patients who use the 1.5 Tesla machine and the 3.0 Tesla machine, but as high as 20% of patients in 7 Tesla machine. Fortunately, these are safe and harmless. It does not cause any permanent damage to the retina or to the optic nerve. Now we have radio frequency risks. First, we have thermal burns and heating. We said conductive materials like tattoo can absorb RF energy, leading to localized burn. Skin to coil contact can also increase the risk of heating injuries. Risks and hazard. We have specific absorption rate. So SRO measures how much RF energy the body can absorb. Most times you put in the patient details, put in the patient weight, and then the machine calculates the specific absorption rate that can be used to produce a good image. However, if the SAR level is high, it can lead to overheating and discomfort. Now we have gradient magnetic field related risks. We said induced electrical current in medical devices, just like we have explained before, that these gradient fields can interfere with medical devices and can cause damage and malfunction. Also, the gradient field also can cause acoustic noise and hearing damage. So the switching of gradient cause generates a very loud knocking noise up to about 120 decibels. This can cause hearing damage if proper protection is not used. Now we're also talking about cryogen related risks. So cryogen is found in superconducting MRI systems, and because the systems use helium, liquid helium for to maintain a constant temperature. So if there's an event of a quench occurs when the liquid helium rapidly boils off, thus releasing large amounts of gas. This can lead to oxygen displacement in the MRI room, posing an activation risk. Another hazard we have is psychological and patient-related risks. Patients may be claustrophobic or may have anxiety due to the way the MRI is structured and has a confined space inside. So patient may not be comfortable going in there. Another risk we have is risks of emergency situations and access to care. So when we have medical emergencies like a cardiac arrest or something of that nature, there's usually a limited access to care because everybody cannot just rush in. When you call in the paramedic team, they cannot just rush in with their equipment, with their defibrillators to come and try and rescue the patient because most of their equipment are MRI unsafe and may even cause more harm than is already happening. So we have this limited access to care, and some monitoring devices are not MRI compatible. So even if you have a patient that is not stable that you want to monitor, most of their monitoring devices are not MRI compatible. Also, we have the hazard that is posed by gadolinium-based contrast during MRI scanning. So if you need to give contrast, there are certain risks and hazards that comes in place with it. We have allergic reactions, like any contrast, even when you're using a normal city contrast, you're using a regular everyday contrast, a patient can react to it, a patient can have allergic reaction. And as you know, this allergic reaction ranges from mild skin rashes to severe anaphylaxis. Impaired renal function. Patients with pre-existing kidney diseases are at risk of adverse effects from gadolinium-based contrast agents. Also, we have gadolinium deposition. So studies have shown that even with people that have normal kidneys, sometimes years after doing this MRI based, contrast-based MRI, they still have deposits of gadolinium in them, even for people with normal kidney. But up until now, no, there have not been any actual correlation with this, with the deposition of gadolinium to cause any specific harm. Also, we have nephrogenic systemic fibrosis. This is a condition that causes thickening and hardening of the skin and connective tissues. MRI key safety. How we've highlighted the risks, we've highlighted the dangers that are peculiar to the MRI department or to the MRI. How do we now ensure that both the staffs and the patients are safe? How do we ensure that patients come in, do their procedure, and they go back alive and healthy? So we have very different methods. However, the one I would like to start with zoning. So zoning is the use of controlled access. That is, there are specific places that specific people can stay. The ACR defines four safety zones to minimize risks associated with power magnets. Zone 1 includes all accessible areas to the general public, the hospital lobbies, the waiting room, the reception, the front desk. In this zone, there is no magnetic field exposure. Zone 2 acts as a transition area between the public space and the restricted MR areas. This is where patients sit, they are asked about their compatibility. This is where their lines are cited for them. At this point, this is where you determine, oh, this patient is not MRI compatible. Okay, or this patient has an implant. Let's do more investigations to find out if this implant is MRI compatible. So in zone two, this is where you do all this. Zone three, however, is a restricted area where only trained staff and screened patients are allowed. So zone three is where you have your MRI systems, your printers and everything. So only trained staff and screened patient that has been screened and have been found to be MRI safe. Only those people are allowed to display. Then zone four is the MRI scanner room itself. It has the strongest magnetic field, which is always active in most MRI systems. Only screened individuals should enter, and also staffs will entry should ensure they are not with any um, ferromagnetic materials. So this is a diagrammatic representation of the MRI zone. So here we have the zone one, which is the waiting area, and then when you are the waiting area, from there you move to zone two, which is the prep area where you change. Lines are sighted for you. You drop your things. You can use the washroom. You can just wait there until you are called in, until you are found to be safe, and then you are called in for your scan. Then you move to zone three. This is the control area. After that, this is the control area. This is where staff stay, where the MRI staff stay. Then you move to zone four, which is the MRI scan, where the patient scan is done. So another method of risk prevention and management, we said strict screening. All patients and staff must be screened for metallic implants, devices, or objects. Use of MRI compatible equipment. Only non-magnetic tools, wheelchairs, and stretchers should be allowed. So the radiology partner should put effort to ensure, or the MRI staff, so that they should put effort to ensure that and whatever comes into the MRI room, whatever is available for use in the MRI room, that the stretchers, the wheelchairs, they should be MRI compatible equipment. Warning signs should be placed to inform staff, visitors about MRI. Like this warning sign we have here that says strong magnetic field, no pacemakers, no metallic implants, no neurostimulators. It just tells patients when patients see it, they are more conscious of their movements into zone three and four. Then we have fringe field. Not all MR magnets have the same field strength, so therefore their forces of attraction may be different. Fringe field is defined as the peripheral magnetic field outside of the magnet core. And then for fringe field, we have something we call the 5 gauge line, which is a line that specifies the perimeter around the MRI scanner through which in which the magnetic field is less than 5 gauge. So here we have the 5 gauge line and the 50 gauge line. So any line, the line that the 5 gauge line is the line in which the magnetic field is higher than 5 gauge. Also for risks for arising from RF burns and heating of tissues, you should ensure that there's no direct skin contact with the MRI coverage or cable. If using body cords, ensure the patient wears the departmental changing gown because this RF burns or heating issues occurs when the patient's skin is in contact with the core. So we have these foam pads to ensure that the patient's body is not in contact with the pores. And also, you should also learn to monitor your patient. Don't just put your patient in the machine and leave your patient. You should monitor your patient and stop the scan if the patient reports discomfort or heating sensations. Now, for acoustic noise damage, use of ear protection, provide patients and relatives with earplugs or noise cancelling headphones. Also, maintain two-way communication with the patient so that the patient can report discomfort. So always tell your patient, oh, you can talk. Whenever you talk, I can hear you. Always provide patient and patient related with earplugs. For cardiology related risks, proper outlets of helium escape. So ensure that the quench pipes that are connected are functional in order to direct the helium outside. And it's also necessary to train staff on emergency evacuation and response, only quench when the situation is life-threatening. So for claustrophobic patients or patients with anxiety disorder, it is necessary for you to talk to them before the scan so they know what to expect and they are not just going in there and they are surprised. So talk to this patient, reassure them, and then tell them they can use the bell. So this is what an MRI bell looks like. So when the patient squeezes it, you hear the bell and you can go and respond to the patient. So you should also try this is a like a microphone thingy that you can use to interact with the patient. So you should ensure that you maintain a two-way conversation with your patient. This is just to ensure the patient is stable, the patient is not anxious, the patient is not shaking throughout the procedure in order to get the best. So for contrast related risks, ensure patients are screened properly for kidney function before administering contrast. Review medical history for if the patient has had a previous history of contrast allergies, and if this has happened, to administer the patient antihistamines. Give the patient water and dialysis. For patients with impaired renal function, they should also be advised for dialysis. So you should have even spoken to them about dialysis before giving them that contrast. That is if the contrast is very necessary and the procedure will not be complete. Ensure hydration after the scan. So for all patients, it's important that you advise them that drink water when you get home. So SAR related risks, use of automated SAR monitoring that can effectively calculate the amount required. Handling patients during handling patient emergencies during MRI scans. So in case of serious medical emergencies like cardiac arrest, what do you do? First of all, you stop the scan immediately. You remove the patient from zone 5 and transfer them to zone 2 or 3, where emergency medical equipment is available. Because if the patient is having cardiac arrest, they are going to need their defibrillators and all, and these things are not MRI compatible. So you just stop the scan, remove the patient from zone 5, transfer them to zone 2 or 3, where emergency equipment is available. Call for help. Allow the hospital's code team if you are trained or if you have an idea of um, CPR, you perform CPR outside the MRI room. Then, in case of projectile environment, what do you do? First of all, you evacuate the area, you keep all personnel and patients away from the area, and you should not attempt to drag out, let's say, a stretcher or a wheelchair or oxygen tank got stuck. You should not attempt to drag the object because the force is too strong and it may cause injury if needed, if in a life-threatening situation, such as a patient is inside and the patient is stuck to and the oxygen cylinder is stuck, then you can quench the MRI machine. Then after quench has been initiated, remove the object safely after the magnet has shut down. Now, only trained personnel should retrieve objects once the magnetic field is safely reduced. So, quench, how do you manage a quench emergencies? A quench emergency, or if you need to quench urgently, what do you do? So, you said MRI, like I've said before, they are cooled with inert gases such as helium. So if these cryogens, if they boil off, either by you initiating the quench or by the quench in a quench has occurred. The issue with a quench is that because the helium is not really safe. It's not safe. So if a quench is initiated, there's potential risk for asphyxiation and frostbite because it is really, really cold. So if a quench occurs, remove all patient and staff from the MRI room immediately. So what happens during a quench? First of all, there's an extreme really loud noise. Then the gas is being ventilated from the magnets to outside, and some gas will be ventilated into the room, raising the risks for an oxygen shortage and liquid oxygen on the floor. So possible dangers of quenching frostbite, asphyxiation. Asphyxiation just explains when there is not enough oxygen to the patient. So instead of breathing oxygen, the person is breathing helium gas. So when oxygen is no longer available in the body, that's what asphyxiation is. Hearing damage because of the extremely loud noise it may cause hearing damage or hearing loss. So this is what a quench button looks like. It is present inside the MRI room. Okay, and it should not be touched unless directly advised by an MRI safety expert. This is not a button that when you're having a bad day, you gotta hit the button, or when your patient is frustrated, you gotta hit the button to cool off anger. If you hit this button when you are not supposed to, you're not only going to cause harm to everybody around, you're also going to spoil the machine. And in conclusion, MRI is generally safe because of its use of non-ionizing radiation, and it is safe for pregnant ladies, safe for children. However, due to its high magnetic field, there's a level of risks and care should be taken to prevent accidents in the radiology department. Staff should also be trained on method of preventing and managing these risks. However, if a risk occurs, it should be reported in the incident log and reviewed. Measures should also be discussed to prevent reoccurrence. These are my references, and thank you for listening.